serve as the chairman of the Board of Supervisors for Sacramento County. And we are joined here by others, as you can see at the dais, who I'll introduce here in a moment. But I do want to start this media event by setting a little context for why we're here. Obviously, the public, the media, everyone across the globe is very much aware of an unprecedented health crisis that we have here in every community. Today marks the conclusion to date of a very deliberate process in Sacramento County to protect the public as stewards of public health here in this community. Joining me here at the dais, we have to my left, Dr. Bielenson, and then to my right, we have Sacramento County Sheriff Scott Jones. To his right, we have Sacramento County District Attorney Emery Schubert. And finally, to my far left, we have the President and CEO of the California Grocers Association. I've been asked to more or less function as an MC for today's media event that is intended to explain Sacramento County's new stay-at-home order, and we are making ourselves available to give our unique perspectives on this action. There will be time for questions at the end of our speaking. So with that, first let's hear from Dr. Bielenson.
Sacramento County now has 45 confirmed novel coronavirus or COVID-19 cases, 3 of which have resulted in fatalities. It is also clear that Sacramento County now has community transmission of this virus. In order to slow the spread of COVID-19, we've been taking significant steps. First, focusing on containment strategies, where we pinpoint the exposure and employ quarantine or isolation in places such as nursing homes, group homes, and the justice system. However, with the start of community transmission, we've had to protect the most vulnerable from exposure to this virus. So on March 9th, Sacramento County began undertaking strong mitigation measures intended to reduce the risk of death and illness among this most vulnerable population. These measures were intended to do 2 things: decrease exposure of seniors and the chronically ill to the virus, while keeping less vulnerable populations from exposing the high-risk population. This evolution to mitigation has also allowed our healthcare system in Sacramento County to plan resources to take care of severely ill patients. On March 12th, state and federal health agencies issued guidance that supported our efforts on mitigation. And finally, on March 17th, the governor's office provided details that strengthen these efforts even further by prohibition of all gatherings, including dining in restaurants. That same afternoon, the county announced its support of these state directives and issued strong directives of our own, which urged those in the Sacramento region to stay home in pursuit of the ultimate goal, protecting those most at risk. In these past 11 days, however, the United States has learned a lot about this virus, but its continued spread in Sacramento County necessitates the additional step of issuing an order. Therefore, as of tonight, March 19, 2020, at 11:59 p.m. or 1 minute before midnight, the Sacramento County Health Officer, Dr. Olivia Casiri, is directing all individuals living in the county to stay at their place of residence except for essential activities, which I'll outline shortly. The legal order is based on the same directives of social distancing issued this week to slow the transmission of the disease, but it provides more detail and enforcement ability. To slow the spread of the novel coronavirus, the legal order limits activity, travel, and business functions to only the most essential needs, with the overarching goal being to slow the spread of COVID-19 and to flatten the curve so that hospitals and other medical facilities are not overwhelmed with a wave of sick people. Let me reiterate. We are issuing this order with the overarching goal being to slow the spread of the virus and to flatten the curve so that hospitals and other medical facilities are not overwhelmed with a wave of sick people. In other words, to spread out the serious cases as much as possible. I know you probably won't be able to see this, but just as an example, if 20% of people were infected over the next 6 months, The darker red are how many hospital beds will be needed. If it's over 12 months, it's lighter, and if it's over 18 months, in other words, really spreading out the cases, it's virtually not unnecessary to have additional hospital beds. The order, and bear with me as I describe some of the details, all of which will be posted after this press conference, states that all individuals currently living within the County of Sacramento are ordered to stay at home or at their place of residence. To the extent individuals are using shared or outdoor spaces, they must, at all times as reasonably possible, maintain social distancing of at least 6 feet from any other person when they're outside of their residence. All persons may leave their residence only for essential activities, essential governmental functions, or to operate essential businesses. All businesses with a facility in the county, except essential businesses, are required to cease all activities at these facilities except for minimum basic operations. And for the definitions of this, please see our public health order, which we put out at the end of this news conference. All public and private gatherings of any number of people occurring outside a household or living unit are prohibited except for limited purposes as described in a minute. All bars and brew pubs should be closed. All in-dining at restaurants should cease, with the exception of home delivery and takeout. And all gyms, bingo halls, and card rooms should close. Nothing in this order prohibits the gathering of members of a household or a living unit. Finally, all travel, including but not limited to travel on foot, bicycle, scooter, motorcycle, automobile, or public transit, except essential travel and essential activities, is also prohibited. Except essential activities, those that are allowed, again, these are activities that are allowed, are defined by the following 6 categories. Number 1, engaging in activities or performing tasks essential to health and safety or to the health and safety of family or household members. Things like going to medical appointments that are urgent, obtaining medical supplies, and prescriptions. Number 2, obtaining necessary services or supplies for themselves and their family or household, and supplies for others, such as food and other grocery products. Number 3, engaging in outdoor activity, providing that individuals comply with social distancing requirements, as we've discussed many, many times before, such as walking, hiking, biking, running, or equestrian activities, including dog walking, again with social distancing employed. Number 4, performing work to provide essential products and services at essential businesses and government entities, as well as other nonprofit organizations. Again, see the definition in the order. Number 5, caring for a family member or pet in another household. And number 6, and this is important, attending private gatherings of not more than 6 non-relatives in a home or place of residence, with social distancing being practiced at all times at such gatherings. This order shall become effective, as I mentioned, at 1 minute of midnight tonight, and will continue to be in effect until midnight on April 7, 2020, until extended, rescinded, superseded, or amended in writing by the health officer. In short, what the order means is to take all reasonable means, whether as individuals, schools, businesses, government, or non-profit organizations, to stay home, only venture out to public spaces when absolutely necessary, and to take any means possible to help others do the same. The goal is to comply with social distancing and limit groups from congregating together in a way that could further spread the virus. Thank you.
Great. Thank you, Dr. Bielenson. As I mentioned earlier, today's order is the product to date of a very deliberative thought process by a number of folks here in Sacramento County. And as we shift from a directive, which has been in place for about the last 36 hours, to this new order, that has given ample time for a lot of coordination with our partners in law enforcement, certainly our district attorney. So with that, at this point, I'd like to turn over the dais to Sheriff Scott Jones.
Thank you, Supervisor. Good morning. I'm here today not only representing the Sheriff's Office, but all the chiefs of police for each of the law enforcement police departments within the city, the county of Sacramento. I think all of us realize that we are in unprecedented times, in terms of this order and the enforcement thereof. And I know there are many feelings of uncertainty and feelings perhaps of folks being unsafe. And in this order, law enforcement throughout the county has been charged with the enforcement of this order. But I want to be perfectly clear that neither the Sheriff's Office nor any of the police departments have any desire to make any arrests or take anybody to jail for violations of this order. We view our role more as one of education, educating folks how to keep themselves safe, how to keep their families safe, and most importantly, as the purpose of this order, to try and keep the rest of the community safe, especially our vulnerable populations. To that end, I know when you call first responders, whether it's fire or law enforcement or EMTs that you need, there may be additional public health screening questions that may be asked of you. I would also encourage each of you, as you need the services of first responders, whatever field that you immediately advise them when they arrive of any symptomology or positive cases for yourself or those in your household, so we can all stay safe and so first responders can stay on the job. I want to assure everybody that law enforcement's priorities have not changed. They always have been and will remain the protections of people in their houses or whether they are abroad within the parameters set forth in this order, and the protection of businesses, whether they are open or closed. That will remain our first priority. I also want to assure everybody that by and large, law enforcement in the county has not yet been affected by their personnel from the virus, that we still have full staffing, and hopefully that will remain the case. So as always, if you need law enforcement, call us and we will show up just like we always have. Thank you.
Great, thank you, Sheriff. And of course, one of our critical partners as well in this effort to implement this new order is our district attorney. So with that, I will turn over the dais to Ms. Schubert.
Thank you, Chairman Cerna. I don't think it can be said enough today that this public health order is about one thing, and that is the health and safety of our community. We must acknowledge that there really are two crises going on here. One, the virus, and two, the fear and panic that many of us in our community are feeling. This order from the Public Health Officer, Dr. Kassiri, is a very clear message about this virus. It is everyone's moral responsibility to act today, not tomorrow or next week. One only needs to see all of the charts flying around Facebook to see the exponential growth of the virus and what happens if we do not practice hygiene and social distancing. This order allowing law enforcement and the district attorney's office to be involved in this crisis should tell everyone the magnitude of the responsibility that everyone holds. We must, as everyone has said probably thousands of times now, we must bend that curve. Time isn't the main thing. Time is the only thing right now. Our office is working with our other government leaders, law enforcement, agencies across Sacramento County to have a coordinated and comprehensive response to this crisis, to limit, as many people have said, including Dr. Kassiri, the systemic risk to our healthcare system. This coordination involves the impact on our court system, on criminal cases, on victims of crime, on individuals who have been charged with crimes. Each of us in our court system has a moral responsibility to follow this order, not today, not tomorrow, not Monday, not Tuesday, today. We must also acknowledge that there is a lot of fear and panic amongst our community. And when fear and panic sets in and people are afraid, public safety can sometimes be impacted. That's why when we have crisis of this magnitude, the law allows and provides that if someone engages in criminal activity, the penalties can be harsher. Now make it clear, like the sheriff did, we don't want to have anybody arrested during this crisis. We don't want to prosecute anybody for violating an order. We are standing here today to talk about the importance of everyone adhering to the law and to this order from Dr. Kassiri. How can we make our community safer? Stay informed, stay calm, stay home, and most importantly, follow this order. Nearly 60 years ago, John F. Kennedy said, "If not us, who? If not now, when?" 60 years from today, history will judge each of us and the responsibility we all accept to end this crisis. I have no doubt that our community will stand up and rise, and we will do so. Again, stay informed, stay calm, stay home, and follow this order. Thank you.
Thank you, D.A. Schubert. And then finally, we are going to hear from President and CEO of the California Grocers Association, Ronald Fong, who will address food supply chain issues.
Thank you, Mr. Chairman. For 122 years, the California Grocers Association has been representing grocery retail here in California. As all of you know, grocery stores are the anchors of each and every community throughout our great state. During this most difficult time, grocers, large and small, chains and independents, commit to serving our communities and our environment and looking to serve everybody in our community. We understand that consumers are concerned and they have anxiety as to what will happen next. But there really is no need to overbuy or to stockpile food supplies. We want to assure you that we will continue to serve our communities and you will be able to purchase your necessities. The food production system, the supply chain, is safe, it's intact, and it is plentiful during this health crisis. What we are discovering is challenges in the distribution center as consumers change to this new shopping behavior. That's a nuance that we need to recognize. What has really changed is the amount of food that people are purchasing during their store visits, and the distribution channel cannot keep up with this current pattern. Consumers should return to their normal buying patterns, and the distribution center will have a chance to recover and catch up with themselves. For instance, if it is your normal pattern to purchase for a week for your family, return to that habit. There really is no need to purchase for 3 months. With that change in your pattern, the distribution supply chain, the distribution channels will return to normal. The spike in volume has really impacted our ability to keep our grocery stores full, often resulting in the perception that supplies are limited, and this simply is not the case. Grocers and their supplier partners are working around the clock to restock their shelves as new products arrive. One person's overbuying can result in another's inability to purchase the food that they need. And in particular, I'm addressing our most vulnerable population, our most vulnerable customers, those 65 and over, who are not able to get to the store as quickly and as often as able-bodied consumers can. There is an order for them to stay in their homes, and they are finding it very difficult to navigate their way through a store. Overbuying compromises their ability and our ability as grocers to deliver to them the goods that they need. The Sacramento grocery community thanks all of you for your continued support, your partnership, and your willingness to join as we all work together to ensure a safe and shopping environment. Please continue to be patient with us and our remarkable store employees who are working double time, triple time to stock the goods that you need. We're working extremely long hours to meet your needs. Thank you for your calmness and your care at your community grocery store.
Thank you, Mr. Fong. So before I wrap things up, I'm hopeful that the Channel 14 crew can actually keep this wide shot on us. We are actually trying to walk the talk, so to speak. You'll notice that we are at the dais here separated 6 feet apart. This is the safe social distancing that everyone should be practicing. We did it very deliberately to make sure that people understand very clearly what we mean by safe social distancing. So before I conclude, I do want to offer great thanks to a number of folks. I've mentioned several times this morning that it's been a team effort here in Sacramento County, not just in the last 24 hours, but over the last 2.5 weeks. Everyone has noticed that we've had sequential interventions, directives, advisories as we get to this point today with our stay-at-home order. First, I would like to thank Sacramento County CEO Nab Gill. I would also like to thank the Deputy Executive in charge of Countywide Services, Bruce Wagstaff. Certainly want to thank our Health Officer, Dr. Olivia Kassiri, as well as Dr. Peter Bielenson, who serves as Sacramento County's Director of Health Services. I also want to offer my thanks to Kim Nava, who serves as our Public Information Director. She's been obviously very busy as of late. And then I also want to thank all of our public servants here in Sacramento County. This is the largest local government in the Sacramento Valley. It hasn't been easy for us, but I'm very, very proud as Chairman of the Board of Supervisors of everyone that calls themselves a Sacramento County employee. Across all agencies, you're doing a wonderful job, so thank you. And then finally, I want to offer my thanks to my peers in elective office, two of which are here. Over the last several days and few weeks, here in Sacramento, there has been a spirit of collaboration between all of us that, quite frankly, we have not seen before. Sometimes crisis does breed this type of cooperation and collaboration, but it really has been remarkable to see from boards of supervisors, various cities in the region, and certainly the 7 cities here in our county, to school districts and others who've come together and really focused on a common cause, which is to keep the public safe. I especially want to thank my good friend and the mayor of our largest city here in Sacramento County, Mayor Darrell Steinberg, for his leadership and the fact that he has been instrumental in making sure that we all march in lockstep. So I will conclude as chair of the board by saying that the Board of Supervisors will continue to do its business in public, albeit with adjusted protocols for public participation and comment. But you can rest assured that one of the essential duties, activities here in Sacramento County will be the continuation of its elected decision-making. And in fact, it probably has not been more important than it is now. And so that will continue. I want to thank my colleagues on the Board of Supervisors, all of whom have been grappling with the same challenges, certainly as I have. They've been doing an outstanding job, so again, thanks to all of them. And with that, I think at this point, we are ready for questions.
I'm not sure who is the best person to answer this, but there's a lot of confusion with the word stay-at-home order versus what people are more commonly used to hearing, which is a shelter-in-place. Now this is a legal stay at your residence. If someone could explain the difference between a shelter-in-place, which this is not, and a stay at your residence.
Shelter-in-place is more.
Could you turn your microphone on?
Shelter-in-place is more related to like natural disasters and things like that, so we wanted to make it more available, if you will, by a stay-at-home or a new residence, as opposed to a shelter-in-place where you would hunker down remains
the
the same
behavior
thing.
should be the same.
Yes.
Can you talk about the change? I mean, we've seen a rapid change from sort of a suggestion of staying home to now it's an order. What has changed in the last even few days for you?
The increasing incidence of the disease, so the 45 cases and 3 deaths are about double or triple what it was a week and a half or so ago. And that's obviously just the tip of the iceberg, because there's still nowhere near enough testing available to know what's really happening. So we thought it was important to kind of sequentially, as Supervisor Cerna was talking about, address this issue in progressively increasing measures, and this is just the next step that makes good sense.
For the sheriff, are officers going to be patrolling, looking for people potentially breaking this? And then is there a penalty or anything like that for a violation, or?
Sure, there's a couple parts to that question. Number one is, we don't expect our workload to just go away because of this stay-at-home order. So obviously, we'll still be doing a lot of the same exact things we were doing before the order. In addition to that, we obviously are going to be looking acutely at neighborhoods and businesses that might be closed or open, just to make sure that everybody is acting the way we should, as time and resources permit. So the second part to your question is about the enforcement. And again, I want to stress that none of us really have, we don't want to think about the enforcement piece of this. It's just what I don't see us being a big hammer as much as an educational tool. However, the eventuality could occur where someone is blatantly continuing to disregard an order or is repeatedly engaging in behavior that's contrary to public health in this order, and then there could be enforcement. The way I would envision that, at least in the initial impressions, would be a citation, which could have a host of remedies, including some administrative and other penalties, money that might cost some folks, and only in the most extreme cases and when absolutely necessary would we actually book someone in the jail. Not for the least of which reasons is I don't want to introduce someone that might be exposed into our jail population, which we're taking great measures to try and keep the virus out of our jails.
Have you been seeing in the last few days, people still going out in large gatherings? When you talk about enforcement, what are you seeing right now that is running contrary to what's been ordered so far?
So I'm going to repeat the questions as we go on. So the question is, what are we seeing out in the community right now in terms of people gathering? I don't know who wants to take the
I'll take a quick stab, and it goes along with what the sheriff was talking about. So I was, after being interviewed by a couple of you guys a couple days ago, so 2 people came up and told me that 2 bars were open. And so could we check on it? So I actually went out to one of them and informed the bar owner, who apparently didn't know that it was going to be an issue, and as the sheriff said, educated them. They closed right away. So that the goal is to educate first and fine second.
Just so the media knows, we've got roving mics, so if you have a question, let us know and we will come to you with mic. Just raise your hand.
question in the back? We can get there quickly.
Thank you. Could you just review the business implication? Obviously, if you're a grocery store, oh, there we go. If you could just review the business implication. Obviously, if you're a grocery store, you're still open, but what should a regular business be doing? If I am, I don't know, a card store, a knick-knack store, I should be closed, or I can be open if a customer needs to get something?
There are a very broad list of 21 different entities that will be posted on our website by the end of this press conference, or shortly after the end of the press conference, that details what are essential activities and what are essential institutions.
Yeah, so
Mic's not on. Oh, she's
you go ahead.
Question in the back?
Hello, can you hear me? I was just curious about the homeless population. Are there going to be citations for those people? Are there going to be shelters set up for them so that they're no longer exposed to the public?
Well, I can speak to the enforcement part, and obviously enforcement, as I mentioned, is going to be a last resort. And obviously there's I'm sure there's other measures, mitigation measures that are going to be offered for that. Now, I think the supervisor, the doctor, might be better equipped to answer that piece of it.
So we have been working with the city and the state and the county on coming up with a comprehensive plan, but I can tell you initially we put out 1,000 units of hand sanitizer. We're working, Mr. Mayor, I think, with the city to put out a kiosk with hand washing stations for obvious reasons of allowing for hygiene and for bringing, getting plastic utensils or non-reusable utensils for places like Loaves and Fishes. And then we're encouraging people to not be in encampments of more than 10, to try and again socially distance, if you will. And we're working towards a way of finding housing or isolation rooms for others who are exhibiting symptoms.
But to more precisely answer your question about citation, there's no intention to deliberately go out and target folks that are unsheltered and make their lives even more challenging than they already are. We want to make sure that they're actually receiving the services that they deserve times 10 at this point, and that means both a combination of making sure that they are sheltered and that they have the wraparound services that they need.
Can you talk a little bit about, as you were saying, essential businesses, right? We've been getting questions from people whose employers are saying, no, you still have to come to work. Does this order mean that if you're a non-essential business, you cannot force your employees to come into work?
I'm not 100% sure. The essential facilities, again, I guess I'll fall back on the essential facilities are listed in this group of 21 different entities, which are fairly broad. And for minimal operating capacity practices, you're allowed to have people come in and work to keep like payroll going and things like that. I don't know, we'll probably deal with this on a case-by-case basis.
I'll add that this is not something new to this order. When Sacramento County issued its directive, like I mentioned about a day and a half ago, the question of essential services, including essential employment, whether it be in the public or private sector, has been one that the public has been very clear they want more detail about. So I suspect that as the order is implemented and we move along, we'll continue to make sure that we answer those questions as best we can, if not clarify formally in the course of what may become a bit of an evolving document. Any questions?
Please forgive if this has already been addressed, as I have not been here since the very beginning. But Sheriff Jones, you mentioned that we're taking precautions to keep the virus from getting into our jail population. What's being done?
Well, a number of things. I won't go into all of them, but I can tell you some basic ones. We've enhanced our screening procedures for entrance into the jail, and we've moved that initial screening outside of our secure booking area, so into our garage sally port area. If folks, recent arrestees have exhibited any symptoms or fail intake screening, then they're going to be sent to the hospital for testing or medical clearance. Within the jail, I have directed that one housing pod in each of our facilities be emptied out in potential readiness should there be an outbreak, anticipating that if there one, there may be several that occur very, very rapidly in terms of positive tests. We also have a number of respiratory isolation cells in our medical wing, which are negative airflow, air pressure rooms, so we can accommodate up to 8 folks in there very successfully, but if not, we have the additional capacity. To create that, I've sought and obtained an order from the courts that gives me the authority to release folks early, up to 30 days, to create the space necessary for what I just mentioned. We have engaged in some early releases. We have excluded folks that are in custody for serious or violent felonies or domestic violence, and we have gone up to about 11 days early to get the requisite number of folks to clear out those pods.
And in terms of the law enforcement officers that are on the street and dealing with the community, what are we doing to make sure that they're protected as they go about keeping the peace?
Well, that's definitely evolving as the situation evolves, but some of the things are going to be trying to obtain relevant public health information before an officer gets dispatched. to a location, perhaps trying to have folks, if the call permits it, to meet them outside in a more arid environment. We're making sure, of course, all of our officers have the appropriate protective equipment when necessary, as well as reminding them all to practice safe hygiene practices pursuant to this crisis. Law enforcement, sheriff's office, and the police departments don't have the luxury of sheltering in place and staying at home. We have to be out there and be at the tip of the spear for this crisis. And I just have to assure people that we're still able to do that. I can tell you that one of the things that worries me, and I think worries all the chiefs in the region, is having it go through our ranks, because many times we are close quarters. We're staggering briefings to try and avoid crowds. But we have already had officers on our department potentially exposed, and a number of them, over a dozen, being tested. Those tests, fortunately, so far have come back negative, or still out. But one of my greatest concerns, obviously, is having it decimate the ranks of law enforcement, and having fewer folks to respond to some of those life-threatening or critical emergencies that are still going to occur throughout this process.
And if I may ask Ms. Schubert, and forgive me again if this is a repeat question, but how is this dealing with the load of cases that you have coming through your office at this juncture?
Well, as of yesterday, I believe it was, the Chief Justice of the California Supreme Court granted an emergency order to our jurisdiction, which has been done across California to many courts, authorizing our presiding judge to shut the courthouse down. So that has been an evolving process. We have, as a DA's office, we've done everything we can to minimize our presence in the courthouse. To the extent we can, we're doing a lot of things telephonically and not going to the courthouse. We are reducing our staff. That has been through the directive of the county. We are only operating on critical functions right now. And again, it is an evolving process. Everybody understands we're all overwhelmed with this. But the court has been in the process of identifying what does have to happen in this crisis. But the court does have the authority to shut the court down.
And what about the high-profile cases that are going through, of course, the Golden State Killer and what have you? Anything that this might affect in terms of those proceedings?
Mr. D'Angelo has a preliminary hearing set in May, so we haven't even had a conversation about that yet. Right now, we're just getting through today.
All right. No further questions, Your Honor.
Thank you.
We have a question?
Yeah. Yes. One from a reporter that's not here. She's asking about people.
Can you hold the mic a little closer, please?
People are going to be cooped up in their home. Do you expect an uptick in domestic violence, perhaps?
Well, I certainly hope not. But we're obviously ready for it. I think that it's just judging by my own house with a couple of kids that would be at school now at home, in their teens that are bored. So I think more or less it's just a matter of personal space, not just for hygiene, but for everybody being able to cope together. I mean, obviously, you're not going to be locked in your house. You can go outside. You can go shopping. You can go out for critical service. I think that's important for people to know. They're not locked in their house like a prison, pursuant to the order. They just have to exercise when they do that. They just have to exercise safe practices and social distancing. So I would hope not. I think, as everybody up here has alluded to, I think crisis tends to bring out the best of us. And certainly I've seen enough of Sacramento County and all its communities to fully expect that the best will come out and reverberate throughout the county as well. And that's my hope. Of course, we hope for the best and we prepare for the worst. We'll still be out there enforcing the laws and keeping people safe.
And just one more thing, Sacramento City's got somewhat of a plan for financial help for sort of small businesses. Do you have a plan similar?
So I'll take that one. We are well aware of the various multitude of impacts that people are suffering from here in this community across the state and nation when it comes to loss of employment and wages. This is about as disruptive as it gets. So we're well aware of kind of the different spaces we need to consider relief. And as chairman of the board, I certainly have been giving that a lot of consideration. I know my colleagues have. One of the things that we will be considering as soon as Tuesday is an emergency ordinance similar to the one that the city of Sacramento recently adopted with regard to relief for renters when it comes to their ability to continue to pay rent. And I'm also hearing quite a lot from my constituents, I'm sure we all are on board, about small business and the fact that they too have similar stress in their lives now with their ability to pay their lease payments for their space. So I suspect that we will be considering these as methodically as we can, but it was I think incumbent to really focus on the renter relief first, because the last thing we want to do is to actually have more people that become possibly homeless, and at the same time we're issuing a stay-at-home order. If you don't have a home to stay in, that makes it very problematic, and so we don't want people to be even more exposed to disease. So that's the first thing that I'm pushing for, and it will be in front of the board this Tuesday.
I think both of these would be for Dr. Bielenson. One, just to clarify, in the listing of essential services or movement, it discusses private transportation that helps people get to like the grocery store. So just to be clear, that would cover like Uber or Lyft drivers as private transportation?
Yes.
So, yes? Okay.
I would imagine so.
Okay. And my other question being just in terms of what we're hearing out of Washington with the promises for mobile testing sites at pharmacies, at Walgreens parking lots or Target parking lots, do we have any timeline for when we might get one in our area, or how is that working?
We have plans for drive-through. There's not enough testing available yet to be able to be done, but we plan on doing it for sure as soon as we can get the testing materials.
And so we don't know still when?
No.
No. Okay.
Okay, we've got two more questions. Here's Sacramento.
I wanted to know, so this is through April 7th, at least for now. And we heard this week from the president that this crisis can go on well through the summer. And I'm wondering, what does that look like? I mean, are we going to see this extend through April? What's the sort of prognosis?
Yeah, I think it's almost unquestionable that we'll see it through the end of April, or probably into the summer, early summer months at the very least. But this is written so that it can be, you know, it ends at a set time unless it's continued automatically.
Okay, any last question? Anyone?
Okay. Seeing none, thank you all for being here.
Good job.